Good afternoon, everyone. Welcome to the Frontline Responders Network, Beyond the Front Lines. We are here today to just have a working lunch with the chiefs, confronting the challenges. And to be honestly, I'm very excited about the fact that we could say good morning, good afternoon, and good evening, because the number of attendees from across the country are very cool. But we're not just in the United States of America, we're all across into Europe. So that's exciting for us to reach that kind of platform. So, we just want to appreciate everyone giving your time to us to have a very good conversation and learn as much as we can about the challenges being faced by the police chiefs in America today. We brought together what we think is a really good group of experienced law enforcement leaders to participate in this first working lunch event for the Frontline Responders Network. So these leaders have joined us from Massachusetts as well as Ohio to discuss some of these challenges that they're facing today in law enforcement. The Frontline Responders Network was created after discussions in March of this year and the beginning of the start of a pandemic and its impact on how our frontline responders are serving and what can we do for those men and women serving on the front lines. And through a partnership of C4 Recovery Foundation and the QRT National, this idea moved from a discussion to a reality, and that's what we have now, the Frontline Responders Network Beyond the Front Lines. The FRN, as we like to call it, is a virtual community for police officers, firefighters, paramedics, health aides, personal outreach, peer support, nurses, doctors, family members, and any other essential service provider that works on those front lines in a time of crisis. The Frontline Responders Network uses constantly evolving resources featuring what we are here today, a live webinar, seminars for technical training, specialized internet bulletin boards, interactive question and answer sessions, as well as behavioral and social support tools to combat the struggle of COVID-19. The Frontline Responders Network is an effort to help and maintain the health and well-being of our frontline workers, allowing them to perform their duties safely and effectively. The community is structured so that the members can drive the content. It's comprehensive, focusing on real-life challenges with real-time solutions from the field. As we shared during our first ever event in July, the Frontline Responders Network is a work in progress. And since that first event in July, Frontline Responders Network has added new partners: Operation to Save Lives, Police Treatment and Community Collaborative, otherwise known as PTAC, and the Addiction Behavioral Health Alliance, Mindshield, and C4 Consulting. This working lunch is our second event, and we're excited and encouraged that you chose to take time of your day and join our chiefs. At this time, I'm going to ask the chiefs to take a couple minutes and introduce themselves. So I'm going to turn it over to Chief Allen to introduce himself, and then we'll begin from there.
Thank you, Dan, and I really appreciate C4, the First Responder Network, QRT National, and all our partners for allowing me the opportunity to speak here on this really innovative, progressive panel. My name is Scott Allen. I retired early this year after 25 plus years in law enforcement. I was the chief of police in East Bridgewater, Massachusetts for just under the last 4 years. And during that time, I had a great opportunity to learn from other experienced police chiefs in my area. And my involvement my reason for retiring was to pursue my passion working with others in the behavioral health world. We helped create a countywide model here to address our opioid crisis, but it evolved into really this integrated behavioral health model. I'm really excited to be in my new position with Operation to Save Lives, joining you, Dan, in that retired sector of chiefs, now trying to help and share with others through the lessons learned. And I'm really looking forward, and thank you for having me today. And with that, I want to turn it over to introduce Chief Mark Denny.
Well, good afternoon, everybody. It's an honor to be here. And like Mike said, and Steve said, it's an honor to be involved in an effort like this. And I've been a police officer 28 years. I've been chief for the last 6, and I think everyone can understand that this has probably been the most challenging of those 6 years. We've all faced a lot of different things that we haven't before. But Corning Township is a very proactive community. We've always been a community-oriented policing agency. We're west of Cincinnati. And we've always been an agency that's allowed to make mistakes. And I think that's important. We'll talk about that a lot today. It's, you can try new things, you're allowed to fail. And you can't hit a home run if you're not swinging the bat. So I've always had leadership that's allowed that and encouraged that. And that's going to help us move forward as well. But thank you for the opportunity to meet everybody.
Thanks, Chief Denny. Chief Botieri?
Thanks, Dan. My name is Mike Botieri. I'm the police chief in Plymouth, Massachusetts, a community of approximately 60,000 people during the year, and that increases through tourism to around 90,000 in the summertime. So we have 128 sworn officers, and it's good to hear Chief Denny talk about the ability to fail, because I think that's important. And I like the way he put it. If you're not at bat and don't take a swing, you're never going to hit the ball. So down here in Plymouth, we have a lot of challenges that we have to deal with. We have our own courthouse. We have a nuclear plant. We have a hospital. We have an airport. We have the tourism. We have a waterfront area that is very active, especially in the summer. So as was mentioned already, the opiate issue that we've been dealing with over the last several years, and then you add this that epidemic, and then you add the coronavirus to it, the pandemic. It's just so much. If you were to see this in a movie, you'd think it was unrealistic and wasn't happening. You would think it would be impossible. So I think it just shows the importance of the Frontline Responders Network and the need to get the information out there and share information with people. So I'm very happy to be included in today's conversation. Thank you very much.
Thanks, Chief. And my name's Dan Malloy. I'm retired chief of police. Served close to 30 years, Southwest Ohio. Had the honor to serve in my hometown community, which it was cool. And also served in the role of Director of Public Safety, worked closely with fire and EMS and law enforcement, and then retired out of a position that is equivalent to the city manager. We call it the township administrator role. And so we got an opportunity to experience a lot and learn a lot, and then also work with people, again, that are willing to push the envelope, so to speak, and not afraid to fail. So that's kind of a consistent theme that you might see across the panel. Is we have leaders on the panel today that weren't afraid to take risks in situations when risks were maybe, I don't know if I want to do that because I'm not sure how this might reflect on me or my agency. And I think that's what you'll see in the next hour with us. So Chief Botieri, if you don't mind, if I throw you in there first, but if you just could talk about, how COVID-19 and has impacted not only your community, but also the epidemic that we call the opioid crisis.
Absolutely, Dan. Yeah, I mean, obviously was quite a curveball that everyone dealt with when it came to the pandemic. We already had a strong program for the opiate issue. We have an outreach program where we track a person who overdoses, and we'll go to their house the next day with a plainclothes officer and try to connect them to care. We'll have some type of clinician or recovery coach with us. So we had a major impact on that piece because obviously we were unable to go to the house and have that contact. What we found out through that program is the stigma is so strong that when you go to a house and you're able to sit in a living room or a kitchen and actually, collaborate with someone and talk about resources and different partners that you have, it's a much stronger connection. So we noticed that we obviously lost that connection, and we did everything we could to continue that contact, although it was this way through Zoom and through phone calls. And I think it validated the strength of the program because we saw, we had a quarterly meeting with some statistics. We saw our engagement rate go from somewhere around 65%, which meant we would find the people and get them make some connection to care, whatever they needed at that point, down to around 50%, 51%. So I think that kind of shows that the program works when you do go face-to-face and go right to a person's household, and you're able to kind of share that information. So in some ways that validated that. Because the impact was vast on the department and vast on family members and all of those type of things, but specifically to COVID, the COVID impact on the epidemic for opiates, I think that clearly showed that it would have been better if we could have gone face to face,
Thanks, Chief. Chief Denny?
Yeah, much like Mike's agency, we're very much engaged in the quick response team model. And that requires face-to-face contact. That's the success of it, is that personal touch that the officers and the firefighters bring. And obviously that was impacted by the COVID crisis. Also, the response model that we had our officers change to was a little more withdrawn and not having that face-to-face contact. So we weren't finding these issues. A lot of times we go to a domestic call and you would discover a substance abuse issue that we could refer to the quick response team. So as we pulled back from some of our face-to-face engagements on certain calls, we lost that personal contact like Mike talked about. And that's why this works. It's that personal contact. You can't do it over the phone. You need to have somebody there, and it needs to be face-to-face. So we've had to adjust to that, and we've gotten back to that model. But we saw some crimes rise. When we weren't engaging the opiate crisis like we were before the pandemic, in the burglaries and the thefts, we started to see those coming back. So there's definitely an impact on our community. Even those that are outside of the addiction area are seeing an impact by us not engaging in the quick response team model.
Thanks, Chief Allen.
Yeah, I just wanted to add, I mean, in talking with a lot of partners, our Plymouth County partners, and then, at PARI as well. I mean, I know, one of the, and there's really no pauses, but one of the things that came out of the COVID crisis was that we started thinking even outside the box more. I know, within Plymouth County, within PARI, they put together kits, harm reduction care kits for, people at risk. We're meeting, people in crisis, in the police parking lots and handing off those kits and information and still connecting the resources. So, even though it absolutely has been challenging and is challenging, it's getting us to think even more creatively, in addition to what we've already been doing for these last, 5 to 10 years.
Thank you. Now, you bring up the issue of technology, and a lot of the conversations was that, the virtual world, just like we are here today, the fact that we're in a virtual community to provide assistance to folks within the COVID pandemic. Did you find yourself going back old school with anything? Did you find yourself, because of, maybe the decreased capacity, the access to technology may have been limited because of the pandemic or people's ability to move about within your community? Did you find yourself having to go, old school, maybe going paper and pen, or maybe going to, flyers on a wall of a local business that maybe seen an increased propensity of overdose incidents? Did you find yourself in those situations?
Yeah, I'll speak to that a little bit, Dan. Yeah, we did. I mean, we actually created a flyer or like a door hanger to put on houses that when we knew there were overdoses there. We talk a little bit about, a lot like what Mark mentioned, is we have this front row seat to the problem. We go to all these calls. So, one of the other issues that happen is, down the same path of kind of going back to old school and trying to locate these people in different ways. We had to assign detectives to actually do some tracking to find out where they would work or where they would be, so we could try to locate them that way. So a lot of that happened, and I think one of the impacts that I wanted to mention was because of the pandemic, there were a lot of reassigning of personnel. I'm not sure what Chief Denny did, but we reassigned all of our street crimes officers who are directly involved in these outreach, engagements back to uniform, and then did some reassignment. So we ended up, losing that whole group in that front row seat piece. So we're in the process now. We just got everyone back to where they need to be, and a lot of strong partnerships that we've developed over time. And with those strong partnerships, you develop relationships. So the loss of 3 or 4 months of that collaboration piece is being rebuilt right now. So I think that was another kind of an impact, if you will, of the pandemic on top of the opiate crisis.
Thanks, Chief. Did you find yourself with, within that partnering network, did you find, because of staffing reductions in so many of, society, did you find some of your partners that were present prior to COVID, maybe they weren't present, 2 months into it or 3 months into it? You had to kind of realign within your operations. Did you, either one of you as a chief, find yourself in that situation?
Yeah, we did as well. Everybody pulled back, obviously, early on. There wasn't a great understanding of how this was going to work. Kind of back to Mike's earlier point was reassignment of officers. And we did that. We pulled our detectives because your main function is patrol. But what we found was the guys who were interested and invested in the QRT model continued to be those kind of officers. So whether we put them in patrol or on night shift when they usually work days, they still engaged our residents in the same way they did before. And they were still in that mindset of trying to help people that are suffering with addiction. So while we did have to reassign them, I don't think we lost all the outreach that we had before. So it's who you pick for these assignments. It really makes a difference. And the culture has to change, and they have to believe in it.
Yeah, to that point, Mark, I agree totally. And that when you mentioned it's who you pick, I mean, if you have the right people in those positions, then this proved that you did, because they continued to care. And I had officers in uniform saying, "Hey, listen, I'll bring a set of plain clothes in. If you need me to go and do this, I'm willing to do it." So I think it validated that we chose the right people. We say this all the time in the outreach world when it comes to recovery, dealing with people in recovery and going to these places that there's a high stigma that we know as police chiefs that you can't send every officer to these scenes. I know officers, Mark knows officers, Dan, you and Scott, all the chiefs listening, all command staff, anyone listening, you know there are certain officers you would never send on this call. We get that. You have to handpick policemen. You have to handpick the people that are engaged and that want to do this. So we want to say that right up front. But to your point, Mark, you're absolutely right. It kind of validated that we chose the right people, because in my experience, and it sounds like you had the same, these people were still engaged personally because they want to be there and they want to help. So it meant a lot.
You're kind of spurning off this conversation. It's great conversation. Within your organization, Chief Denny, you spoke of it. You talked about culture. You talked about, while you may not be specifically assigned to a certain role and responsibility that may be associated with the outreach, you find yourself maybe possibly engaging people in a different environment than specifically to the QRT or to the outreach team. And did you find yourself maybe evolving and doing some other type of engagement, i.e. like safe stations, or make yourself available self-referrals, or, being, other things that are the pathway to recovery that maybe you weren't looking at because you're trying to make sure you reach that facet of our community that it was in need? Did you have those conversations?
And we did. We set up a system for referral from officers to make sure we weren't missing people that weren't falling through the cracks. And I found out a few of them had actually given their personal cell phone numbers to people that were suffering. So again, back to who you pick. And leaders are responsible for matching talents up with necessity and skills. So we missed a lot of opportunities. We stopped responding to shoplifters and things of that nature, where we were having a lot of contact with people that were in need. So we definitely were taking every opportunity to find those people, make sure we didn't lose them, and then reach back out in the moment that we could.
Thank you. I think that kind of leads into the next question we were going to talk about, was those operational challenges that went from what we were doing in February was good, but March we dealt with, and you said it, we had to move, both of you chiefs, we had to move officers from certain roles and responsibilities to serve that primary duty of patrol, which meant we weren't, we kind of centered our actions and got to make sure we could provide the basic function of service within our community. But to the people, they believe in what they believe. They understand the culture and the tempo set by that mission and vision of your organization. So they're doing the work, even though they're not necessarily in that specific assignment role, a time slot of the day, whatever that may be. Those operational challenges, how have you guys worked through that? How have you evolved? I mean, what you probably were doing in March might not be what you were doing in July. I'm sure you've learned a lot along this journey.
Yeah, we looked at it very early on as it was spreading throughout our community. And the concern was, what happens if all my officers get sick? And that was a real concern. And number one, you need to worry about your people. You need to worry about your officers, and you need to take care of those fears that they have. But you also have a responsibility to your community to serve them. So we did some out of the box thinking, and we changed some schedules around that put half the department on furlough while the other department was working. So if we had someone get sick, it wouldn't run through the entire department. But that took educating of our officers, our leadership in the township, and the community to understand that, while we are changing the response model, we are going to have to pull back on some things. And that's a difficult conversation to have with some people. The community wants the same level of service that they've always expected. So we really had to take stock of what we were responding to and how we were going to do that. Everyone responded well. In fact, we brought everybody back for a certain period of time. We had a resurgence of the virus, and we returned to the model again. So I think knock on wood, we've kept all of our officers healthy. But for a 55, 56-man department, that would be devastating. And there's not a second string police department. If this police department's sick, we have nobody to respond. So it takes bold action, and not everyone's going to agree with the decision you made, but you're the leader. And sometimes you step up and you do what you have to do to make sure that your men and women stay safe first, and that you're still offering that service to the community.
Yeah, I'm same thing here, Mark. We did the same. We tried to obviously limit contact with public while providing a service as well. When it comes to the officers, we went on a 4-and-4 schedule. Officers were on a 4-on and 2-off schedule. We went on 4-and-4 and split the department in half. So limit the exposure. So I guess if that works, then what you have there is Group A never works with Group B. So if there is a contact or an incident, that works well for us. And I'll throw in a couple of things regarding the union. The unions, we met with the unions, and Mark probably dealt with the same, and said, listen, here's the deal. I know the contract says everyone gets overtime equally, but I think that each group should work overtime in their own group so we're not cross-contaminating. So they made some concessions like, that makes sense. I'm trying to keep my own people safe. That's outside the contract, but it was the right thing to do. So, I mean, that being said, I think that we needed to make sure our officers felt safe. And we know a lot more now than we did when we started. Like Mark mentioned, you can't have the whole department go out. I remember originally thinking if one officer got it, we'd lose the whole shift. We know now that it's not as debilitating. If we have contact, we did last night, had contact with someone who we're told today has COVID, and public health say if the officer wasn't within 6 feet without a mask for more than 15 minutes, the risk is so low they can continue working. So things got better. But in the beginning, to Mark's point, I think not only do we have to make sure we keep our officers safe and the public safe, but they have to feel safe. So it's a perception. We could sit up here in our offices all day and say, I've done everything I can. Well, look at me. Look at all these things I did. If the guys and gals don't feel that they're safe, none of that means anything. It just means the command staff feels that way. The town itself, the management of the town manager, they went on the same type of thing where they split everything in half. And they even included the command, their town management and command level. We didn't do that here. I have 2 captains, administration and operations captain, and the town really felt that we should split our time in case one of us got sick. We felt strongly that we needed to be here the whole time. So all 3 of us, we social distance, but we worked every day because we just didn't. Could I work from home? Absolutely. They could have worked from home too, but the perception of us being home while the officers are here just didn't fit. And I explained to the town, we're different. I just feel that policing is different, and we need to present and make sure that the officers feel engaged and that we're with them all the way. So those are some of the different changes we did because of that.
Thanks, Chief. And I appreciate the fact that, you do lead from the front, and you can't lead from the front from your couch. And that's the difference between, leadership on the front lines versus in other roles. And you have to demonstrate what leadership means so your men and women know that you are in it for them. Like I say, it's not just responding to the roles or responding to the calls. It could be answering the phone. It could just have your presence. The fact that you're there in the middle of a pandemic demonstrating to them what leadership is a big deal. Chief Allen, is there, I know from your role and your relationships and things of that nature, have you learned and experienced anything that might, being a little bit on the outside, kind of you could stepped out right at the beginning of this, be interested to learn what you might think.
Yeah, so the initial, obviously timing is everything. Had I known, who knows? But as I retired in March, right as this was hitting, one of the things that I saw from the outside retired chief law enforcement was the non-law enforcement partners, those community organizations, behavioral health. It allowed them to step up where officers who were collaborating in a co-response model really couldn't dedicate that time because of the COVID crisis. What I've seen is in my engagement and my volunteer work with our local substance use coalition in the county is that they've now become more involved, which I see as a positive, because we know at the end of the day, as law enforcement, as public safety officers, we wear many hats, but we're not the experts in the behavioral health world, if you will. So, but it's allowed us and our partners to grow and develop those relationships. So now I'm seeing, our partners really taking more of a leadership role and allowing the law enforcement to continue to collaborate together, but not necessarily having to be the lead in all of this. And I think that's one of the key things that I see from this is that this is a time now more than ever that public safety, policing and public health, we can forge even stronger relationships.
Well, we used to say, what is the silver lining in the cloud of collaboration and new partnerships? It's when that next something happens. We just weren't, I retired before the next something occurred. You guys are in it. But when you come to the table as partners and collaborators, you don't have to try and gain the respect. You don't have to know where everybody's coming from. You just know that I'm a part of the team, and that team could start operating from day one versus trying to work through all the egos and all the things that go into that reset. So, I applaud you guys for being in the front end of that. And Scott, you're absolutely right. Is there a lesson learned to, Mike and Mark, is there a lesson learned that we didn't operate this way before, but I like what we learned about ourselves during this, this pandemic that may be helpful to the other chiefs on the call?
Dan, you mentioned the silver lining was your phrase, and it really struck with me. We had a lot of things we wanted to try, but just didn't have the opportunity to try. And I think having to respond differently to this model allowed us to try some things that we hadn't done in the past. A different response to shoplifting was a big thing. We're a very retail heavy area, and that takes a large percentage of my officers' time. And we'd always had some models in mind that we wanted to try. Well, this forced us to try it, and guess what? It worked. So you got to find the positives and the good takeaways from these. But I think the biggest lesson I've learned was you need to lead. There were agencies in my area that stood back, watched what we did, and certainly had criticism of it. And unfortunately, they suffered by having guys get sick. Your job is to lead, not to be popular. And sometimes you need to step up and set the trend. And we had agencies call us for help on changing their schedules like we did. And we were, proud to do that, and we were glad to be able to help. But not everybody does that. It's easy to stand back and not take the criticism, but as leaders, you need to step forward and do what needs to be done for your people.
Yeah, in the same lines, I agree with you, Mark, 100%. I think the lesson learned for me, and I think it's something that all chiefs should be working on a daily basis, is there's a lot of value in what we do every day. And what I mean by that is that we need people, not just our people, but the community, to have confidence in what we do and trust our decision making. And we need to do that on a daily basis, whether it's meeting with town council or meeting with neighborhood watch groups or walking downtown and talking to people. They should know who the chief is. They should have confidence that they'll do the right thing. So when something does happen and there's a pandemic or an opiate issue, or quite frankly, some serious incident with an officer on or off duty, I want the first thing that runs through the minds of my citizens and the officers is that we'll do the right thing. And you'll have that time to react and to respond. It's not a freebie. It doesn't mean that if you don't do the right thing, you're not held accountable, but you have time to breathe. If you look back at Ferguson and issues like that, I think there might not have been as much confidence in the department. So the automatic assumption is they're going to do the wrong thing. Oh, the police, they're going to do the wrong thing. If they know you and they put a face to it and they know Mark and they know that if something happens in Mark's community, the type of person, the type of leader he is, he's going to have time to breathe. He's going to have plenty of time to respond, do the right thing, and be held accountable as opposed to a quick reaction. So lesson learned for me is all of those relationships that I've worked on and you've all worked on over the last 30 years or say 12 years of being chief, they pay off when these things happen. People line up, they have confidence in you, and they trust your judgment, and they trust your department to do the right thing. So I think that's
Mike, you heard, and you trust. And I think that, that's part of our conversation today but you can't start with that today. You can't start with that after the event. You have to be working on that belief from your community in its police department and as well as its leadership is something that is earned over time. And it is an earned relationship. It's not something you get just because you put the Chiefs badge on or you get because you put the uniform on. It is a reality that we have to earn that, and we have to earn it on an everyday basis. But before I jump into that next piece, one of the things I think is very interesting as we're all doing, because we're doing it today, is the change in communication. The realization that the way we communicated before is different than we would communicate now within this pandemic. And we've learned some things, the ability to reach, across the country, the fact that Massachusetts and Ohio are in this conversation together without any of us having to put any travel expense forms in or get any of that kind of thing done. We are sharing information to a cross-platform of folks from all around the world, which is, that's the benefit. But internally within your organizations, how did you, Chief Denny, you talked about it. it's not just a downward to informing your officers. You have to inform not only your officers, your fellow department heads, up the chain of command, even to your politicians in your community. How did you guys work through that, if you don't mind?
And you're right, you have to lead up. And a lot of times your politicians and your administrators look to you to be that steady hand on the wheel. It's very difficult to move forward if you're not keeping yourself informed. I mean, this changed so rapidly from week to week for a while. You know, what were the right things to do with the masks and social distancing? You become that person who needs to stay current and pass that information along to your people. You can't assume that they're taking the time to be informed and as you are. So it's part of the leadership. You need to be that voice of authority to them, that when you tell them something's changed or this is the new direction we're going to move, then that's what you do. But it's constant communication, constant education of yourself. And Mike said it, you don't just make a decision, stand back and take your breath, put your feet up. It's a constant effort that you have to be doing. And especially in this pandemic, nothing was the same day to day. And then you throw some other things that occurred throughout the country and it really put us in a spiral. And your guys look to you. That's where they look when it's time to get a straight answer.
Yeah, same thing here. I found myself in roll calls much more often than I ever was before. And to be honest with you, I probably should have been more before, but it kind of highlighted that to me. But because of that, I needed to be in the beginning, down there in the forefront, having our roll calls outside in open air spaces, explaining why. And like Mark says, I mean, so much information continues to come down today on the epidemic. And, you know, should you wear masks? Do you not wear masks? You guys have seen it all over the country. The information, one day you should, one day you shouldn't. In the beginning, that was difficult. So I think the sharing and communication of information, I found myself reading all these things and really looking at them as to what needs to be passed on, because I didn't want to miss something that was going to be important to a day-to-day response of an officer. And they're thinking of their family members going home when they're having children and they have family members, and a lot of people involved, police officers, a lot of public safety and first responders are married to first responders. And I missed that. I'll be honest with you. I missed that completely. And I started hearing like, well, my wife is a nurse and she might've been exposed. And I'm thinking, well, I never really thought of that. So there's a lot of struggles going on in the household, but the communication piece was to make sure that we passed that on. I met with the union leadership on a lot of these things and said, listen, you know, we got to work on this together and move forward together. I absolutely believe if I just implemented some of these things, I would have had a lot more problems than engaging them and let them be part of the process. They should be part of the process. They're on the ground. We're going to make a decision, and they know that. We're the leaders. We're going to make a final decision, but to not accept their input and make them part of that decision-making process, I think would be a big mistake. So that's, if we will, another lesson learned.
And Mike, you touched on it, the fear of your officers. And I think we underestimated that. You know, we have a lot of young guys that came forward and said, hey, I don't know that I could put myself in this position to be putting my family at risk. And it took sitting down with them and reminding them of why we took this job in the first place. These are the times we accept the pats on the back and the congratulations. It's for these times for us to step forward. So, you know, we all accept the congratulations. It's time to earn them. And
yeah, I missed that too. I missed that too, Mark. I really did. I got to be honest with you. And in the beginning, I've been around a long time. I've been 35 years on the job, and I never thought that we'd be administrating medication like we do when we go to use Narcan. So the policing philosophy has changed completely, but I totally missed that piece about, in my mind, in the back of my mind, I was thinking, suck it up, come to work, you got a job to do. But I was wrong. You know, I was wrong in thinking that. And I learned really quickly that these are young officers. I have a lot of young officers. Of 128, I have probably 75 officers with less than 6 years on the job. A lot of brand new young officers. They don't know policing without the use of Narcan. They came out of the police academy. Half of my guys knowing policing means utilizing Narcan. So I have to put myself in that mindset, but I missed that completely, that whole, these are young families, their wives are having babies, they're concerned. Some of them are nurses, they're in the public safety field or first responder field. And I take full responsibility on that. Man, I missed that one. But we've made changes and we've corrected it. And communication, as you say, Dan, big piece of it, and just keeping everyone involved in the decision-making piece.
Well, give yourself a little credit, because I know Scott can speak to this too. The reality is seeing it and then evolving with it and learning from it and then changing in the way that you conduct your business is leadership. The fact that you don't lock in and put your feet down and say, you know what, because I said so, or this is the way we've always done it, this is what's going to happen because I only know this way to do it. So, that's the important message in here, is the realization that this is an ever evolving issue. and we have to be responsive to it. You're responsible to educate yourself and commit to the information. And the other part, I think, in a lesson learned, and I love them, is the fact that, as to Scott's point, this enhanced collaboration that we've gotten in ourselves into is that relationship now, as we're dealing with a public health pandemic, to have a relationship with our local public health where it's Dan calling Mark, it's Mark calling Scott. It's not, hi, Mr. Health Commissioner, I'm the chief of police in Coleraine, or and trying to figure it out. You pick up the phone and you're calling a friend, a relationship that allows you to better understand and get the information so you can be informative to those men and women that you serve. So I think that public health relationship, again, another one of those unintended benefits that collaboration has given us in this world setting that we are right now. It allows us to be a little more forward thinking and be a little bit more knowledgeable. So I love the lessons learned. I love that fact of the matter, because that's why we're here today. So
before you jump on, Dan, the one thing, and just more, it's an observation, listening to Mike and Mark, as great as this, they have this technology to be able to do this, what I still am hearing is, at the end of the day, you still have to have that face-to-face contact, asking your team, hey, how are you doing? What do you need? How do we do this together? And that, so, because sometimes I feel like, I'm emailing too much, and even as a chief, I'd find I'm sending out emails, but you got to get into that room, that roll call room, like Mike said, and really talk to the troops, and hey, how can we make this work for you collectively better?
You're absolutely right. It's 24/7, 365. It's just not Monday through Friday, 8 to 4. And I think the real leaders demonstrate that. They see that. And that's why we're here today, is to realize that you take on that role of responsibility. You take on the responsibilities of the men and women you serve. And that means you have to make adjustments to meet them. And as both chiefs said, we have to evolve and we have to figure it out. That ability to engage can't just be done via email or via virtual, world. Your men and women are on the front lines, and they deserve to see you. And I think that's the piece that's very important here. Any last thoughts before we move into the next set of questions, Chiefs? This has been fantastic, but I want to make sure we give the next content our best. So is there anything before we move on to the next set of questions? Awesome. Chief Allen, I'm going to toss this your way. We know that the nation is in a state of unrest, and, we at the front lines, you guys, Chief Mike and Chief Mark, the reality is you're dealing with this every day. We're dealing with from a distance, but, this isn't something that just occurred overnight. This isn't something that just happened in 2020. This conversation about trust, as Mike shared earlier, that relationship building, the feeling that the men and women who wear the uniform in your community are there for you, is a big deal. And, can you offer some different perspective on, I know that we're going to get to them and what they're dealing with today, but, based on your experiences, can you, paint a picture for us?
Sure. And obviously, Mark and Mike are they're actively in this, unprecedented time for obviously our country, our world, our profession. Unfortunately, when in 2014 we had, Ferguson, Missouri, and as a result of that, the 21st century police and the 6 pillars, came out through the president's task force. And I know when I took over as chief, and prior to that, even as a sergeant, starting to implement those pillars was, that recipe, that there was a playbook to make sure that you were engaging, marginalized populations, or recognizing, I looked at it as a self-assessment of my department, of myself as an officer. Are we doing everything we can and should for all populations? And really, with the opioid crisis and the mental health crisis, those are those marginalized populations that we know are, at risk, that we need to connect with. So when I took over, I really, went into that 21st century policing, playbook, if you will, to build the trust in the legitimacy in my town. Looking at a self-assessment, my town is, predominantly a white community. And, I need to make sure that our officers we're engaging, every population, fairly equally. So it included, sitting down with the officers. All of my officers over my, almost 4 years was anti-bias training, cultural awareness and diversity training, implicit bias, racial profiling. Many of us chiefs, we took that 21st century policing and ran with it. So we did that as well. In addition, I looked at our department. I said, we put out a survey, did a town survey, and we weren't looking for the survey to, pat us on the back. I wanted to know from this survey that I had partnered with Boston University criminal justice professor on. I wanted to know where our weaknesses were, because I think what we need to do as law enforcement professionals is identify, the populations that we're not connecting with or who feel marginalized, and we need to recognize that, and then we need to sit face to face and take their, listen to them. And I that's one of the lessons learned from 2016 and on as chief is with my deputy was we need to engage populations who don't feel like they're being treated fairly and listen to them and then implement change. And through our training, I was fortunate enough to be involved in a documentary, Protect, Serve, and Care by a local production company, Newbie Productions. And it featured, officer-involved shootings post-Ferguson, and then, policing engagement minorities. And I, that was just an experience for me. And I was able to bring that documentary showing at our school because, sharing that with our new, generation to let them know, these challenges that are out there. And, to me, the awareness, but it's the recognition. It's the recognition, hey, you know what? We're not perfect. We need to do a better job. How do we do that?
Thanks, Chief Allen. You hit on a lot of things for me, and I don't want to take time away from. You got my brain racing, and there's just a lot of important statements that you made. And one of the things is engagement. We have to build trust from somewhere, and we can't do it from a distance. We have to look them in the eye and listen to their information, listen to their questions, and listen to what they really have to say, how they feel. And it's an important relationship building tool. We have them to see us as real human beings because we have to see them, our community as real human beings. And that's a big part of our role and responsibility. Mike, do you want to step in here? Because I know you're dealing with this on the front lines today.
Yeah, I think it's really right down to 21st century policing, fair and impartial policing, listening to people, letting them be part of that process. I'll touch just really lightly on what I mentioned earlier, creating those relationships ahead of time. So when something like this happens or there's an allegation, there's so much I could talk about, but I don't want to take too much time. But I do want to tell you that the perception of not just your people, but your community, I pride myself in spending the last 24 years since I was in the command level in the police department with forging those relationships and knocking down barriers and being that guy. And I'll tell you right now, I'll tell you really quick if I can, there was a vigil that was going to happen, a Black Lives Matter vigil, and it was right after, and there was a lot going on throughout the country, and I didn't think it would be out of control. And I felt like I had a good grasp on it. And a local group called No Place for Hate, that's probably nationwide, No Place for Hate, came forward. They would do the vigil on town property down at Brewster Garden. And in conversation with them, I basically said, geez, you think you should? There are sometimes people infiltrate. There could be problems. What should we do? I'll be there and I'll have officers there. And somehow that got misconstrued and it went out that the chief has canceled the vigil. Wow. Like it killed me. Like I lost my reputation in 10 minutes and I fought to get it back. I remember that night, at midnight, I was talking to local papers saying, you got to fix this. I never said that. And we corrected it and I got behind it. And I never knew how frightened the businessmen and the local people were because they're watching TV, seeing, cars being burned and that type of thing. And now there's one in Plymouth. And they just were convinced it was going to happen and that we weren't going to be able to protect them. So, we put on an extra 20 or 30 officers. We had officers in front of all the storefronts downtown. They had pictured just breaking windows and those things. And it wasn't enough. So I went that afternoon, I went downtown and said, they got to hear from me. And I went in every one of the businesses and said, look, we're going to be here. And boy, have I heard that went so far. It took me about an hour and a half of my day, but it really fixed things and I spoke at that vigil and I, denounced the actions of, regarding the death of Mr. Floyd and all that, like all chiefs have done. But it's to me, what a message, like I could lose it so quick. If the wrong message got out there, all of a sudden, you work so hard to get that type of reputation. So I think it's all about fair and impartial policing. That did go off without a glitch. There was some marching. We had plenty of officers there. And then the follow-up, I think you have to follow up with your officers. And I think we as chiefs forget it. I find myself telling you a lot of mistakes I made and how I fixed them. So I feel bad about it, but I think that's part of being a leader and just saying, hey, I could do it better. And I made a point of making sure, the entire department got a message from me that, hey, you guys handled yourself professionally. I appreciate it. And it meant a lot, it meant a lot to me. So.
Well, Mike, again, to be able to humble yourself in front of a world today between 1 and 2 p.m. Eastern time and share that, I made mistakes, but that's what makes us human. The reality, and I think Chief Denny is going to lead to this, is the reality is we're working as men and women, and we are human beings, and human beings make mistakes, and we have to be responsible for that, and we have to work on betterment, and we have training, and a lot of things go into the reality, but the reality is we're human beings, and to be able to stand in front or sit in front of a computer and acknowledge the fact, I learned a lesson from this, and I'm better for it because I responded this way, and I took action that way, and I'm, it's the reality is we make human mistakes as human beings. And it's just the fact that you're, as a chief of police, willing to humble yourself and acknowledge that is, again, it's impressive. So we greatly appreciate that. And Chief Denny, I know that you've been working on this for a few years.
Well, Mike just defined it. And I said it before, is our biggest fault is we stand up and we tell you just a little bit of the facts, and we keep things to ourselves, and, we'll give you more information when it becomes available. Sometimes we're wrong. And I think the most powerful thing from George Floyd was that next day, chiefs across this country stood up and said that was wrong. We weren't making excuses for it. And you better have built up a relationship, though. In the years before Ferguson, we reached out to our community through an outside facilitator to engage in conversations about how policing is seen in our marginalized communities. Are we doing enough to reach out to them? Are we doing the right things? If you're trying to make that relationship after the bottles get thrown, you're too late, and you have no credibility. This has to be an ongoing relationship. And if you don't look at Ferguson and Minneapolis and see that a small event in a faraway city can bring havoc to your community, you're not paying attention. We also had a march. We had a group of teenagers march in Coleraine, and there was some chatter that there was going to be counter protests. So we organized a response on our part, and the goal was to keep ourselves out of view and out of sight. But we found about halfway through, it was interesting. We commented that all of our efforts are being centered and focused on protecting the people who are going to march and tell us how much they hate us. How great is that? We as a police department weren't trying to stop it. We were trying to guarantee they had the right to speak up and have their voices heard. And that really went a long way with that group specifically, but people that were really paying attention to the events. We didn't have the protests that a lot of other cities across the nation had, but again, that is a constant work that you have to be engaging in, and it's building those relationships. I've already got a full list of churches I'm going to speak at after this pandemic lifts up, and we're able to go do that again. But again, we have to rebuild relationships. Sometimes you take 2 steps back and 1 step forward, but I'm proud of the relationships we built in this community, and I think it made a big difference for us.
This is, and I tie back to the first question, the opioid response, the overdose issue, the proactive work that both your agencies are doing. And, I remember the comment that was made from our treatment provider partner when we started the quick response team in 2015. And the statement was made that this is the post-Ferguson community policing model. And, the question was, well, why do you believe that? And the response was because they don't believe that police are going to care that much. They don't believe that you're willing to go out of the way to figure out how to give them the help and the services they need to return to a life of normalcy and to help the family. So that always resonated with me. I was like, because if you think back to, and Chief Denny said it, we had Ferguson, we had Charleston, we had New York, we had Baltimore, we had a lot going on. And one of the couple of things that were learned during that process was we need to engage the community. And I believe we called them just a conversation, where we encouraged, just let's get gathered together. And, I remember the sitting in a circle, touching knee to knee, and because we had to initiate a relationship with the person to our left and to our right. And, and there was a lot of uncomfortableness, but the reality is we got, the opportunity to talk to people that otherwise we might not get a chance to talk to. And I guess one of the lessons learned is we took from the Ferguson event was the lack of understanding that the coroner was responsible at a certain point in time in that incident. And, when we call the coroner's office, that scene becomes part of the coroner's response, and it might take them a while to get there. And we took it as, okay, how do we protect the scene? How do we protect the dignity and the respect of the individual that is on that scene there? And we, learning and listening and trying to be proactive, thought, well, let's get one of the tents and keep that out of, so not everybody just stand there watching this person. So the family feels that there's respect shown and the individual's respected. And during our conversations, the question was, well, what are you doing behind that blockage? What are you doing behind that barrier? And to each of you said it, if we don't have a trusted relationship within our community, that's a fair question. What are we doing? Are police doing something back there to manipulate the scene to better protect their reputation, their work, the things that they did to be here? So again, this has to begin well before the incident occurred. And the reality is, while we were working on building those relationships and gaining that education within our community and helping people understand that while other departments may engage in behavior this way, this is what happens with the men and women in your department. And in your community, well, there was a police-involved shooting. It's a fatal encounter in our region. And next thing you know, it was right in the middle of our first event. And we had people from all over the region, not just our community, that attended. So we had a lot of different perspectives and a lot of different questions being asked. But again, it leads to the depth of this, is that there's a lot of folks looking for those answers, and to have leaders sitting in the seats with a willingness that, you know what, we'll talk about it. You go ahead and ask the question. What's our policy when it comes to an officer-involved shooting? Well, how do you process the scene? Who investigates it? Well, the local prosecutor is key to that investigation. Little nuances, so there's an understanding of who's involved and how decisions are made, gives people an understanding well before. It doesn't look like you're reactive. It's like, you know what, this is an open book. This is how we operate. And this is what the men and women are of our organization. This is how they're hired. This is how they're expected to behave. This is what we do as an organization. And I applaud you guys for understanding that, but that's more of our responsibility as leaders within our communities, to be open and upfront about the way we do our business. And, this is such a, we could probably take in a whole hour, discussing this. And I don't want to limit that, but is there a recommendation that you might have if I'm sitting and watching on the other side and I'm saying, this all makes great sense to me, but what should I do first? I mean, I'm a smaller department, I'm a smaller community, I don't have all these resources. Is there, or even if you're, 1,000 officer department, is there something that maybe you think this was a good thing to do? This was a kind of a good first step for me. Do you have either one of you guys, Scott or Mark or Mike, do you have a suggestion or a recommendation?
Yeah, I think it goes back a little bit to building relationships like we talked about, but I think we really pushed that forward. I think that makes perfect sense. But I think it's just important that I think we need to recognize that 80% of the public never call the police, okay? And that means most people don't know what we do. And I think if you ask the chief or any police officer to define your primary goal, our primary goal is really respond to 911 calls in a timely manner, right? We need to get there when you need us as quick as we can. All the rest of the stuff is just peripheral stuff. But most people don't call us. So when I talked about earlier about it's our job to make the community safe, it's also our job to make them feel safe. It's a perception. I think we forget that. So an example I give real quick is the Boston Marathon incident. I think it was 2013. We learned a lot from that. And some of it was just visibility. Like officers should wear those green vests. So when you look down the street at a parade, you see 20 officers, whereas before you would see any officers. Perception, things we needed to learn so the public knows you're prepared. We don't share operational plans, nor would we ever on a major event, maybe a Thanksgiving Day parade or something, but we share with specific groups that we have a plan. So the plan at the Boston Marathon worked. They did it for 30 years and never needed it. But they had so many injuries. If you remember that day, 3 people died. And everyone was waiting to see how many more would die because people lost limbs. 20, 30 people lost limbs. More people should have died. They didn't. They didn't because there was a plan in place with the EMS. and they knew where the level 1 and level 2 hospitals were, and they didn't overburden one hospital because they had a plan in disbursement. So when those people got to those emergency rooms, their lives were saved because there was a plan behind the scene. So I think we should share a little bit, not operationally what we do, where we are, how we do things. Just like that vigil, I could have made a phone call. I had people ready to come. I could have had 100 police in about 20 minutes. People don't know that. So I guess my point is that most people don't have contact with us. We want them to feel safe. So don't be afraid to share. And it's not always money, like I need more overtime or whatever. I just need to, little things like the visibility thing. You look down a parade now, you see 20 vests in a half a mile. You know police are everywhere. We were everywhere before, but no one saw us and knew us. So I think we need to put a little more time in perception so people feel safe. They feel like the police have this, and if something happens, they know what to do.
I think just to piggyback that, as we're talking about racial equality, you know, in these inequities, I think that the key piece, and Mike, you hit on it, is to get, you know, to talk to the community, but to get with those vulnerable populations or the populations that feel like they're not being heard. You know, and I think one of the lessons learned from my end is my time as a chief is, you know, it was a community engagement, but are you making sure you're listening and letting them be heard, and then taking that and collectively, because with the recovery community, we listen to the recovery community because they're at the ground floor. It's got to be the same thing when we're dealing with racial inequities. Is I can't put my shoes, myself in someone else's shoes as far as for being, you know, a racial inequity issue. So you need to get with those people, listen, and then implement changes based off of those their experiences.
Well, I mean, I think again, your point is when we ask the questions, we got to listen. We got to listen to the answer. And you know as well as I do, you've been in this profession long enough. You guys have, is, you know, people look to law enforcement and they look to leaders oftentimes to direct the flow, direct the, you know, the conversation. And sometimes we have to just shut up and listen. You know, we need to know what we need to know, and we need to listen to the information, to the answers that are given. And I think that's an important part. Chief Denny, I'm going to turn it over to you, but before it's about 3 minutes till. Just for everyone that's on this call with us or on this meeting with us, we're going to get a quick poll. It's going to ask you a couple of questions. Most importantly is, when is the best time for you to receive this information? What's the best time for us to host an event to make make it available for you? So please don't leave before you take that poll. And again, Chief Denny, you know, I want to make sure you have an opportunity to add in here.
Yeah, an area we struggle with, and I think probably chiefs across the nation struggle with, is diversity within your department. And, you know, that's been argued back and forth, but communities want to see themselves in your police department. So we've really worked hard to try to increase our diversity. We started a scholarship program. In Ohio, candidates for police jobs are often required to pay for their own police academy. And we were finding that was taking a significant portion of the minority population out of the pool. So we offered a scholarship to underprivileged or underrepresented members of our community. And we've hired our last two, and one was just promoted to a supervisory position. So it's worked out great for us, but it's also increased our credibility with part of our community that maybe questioned that a little bit because they were looking at an all-white police department in a community that's 20% African-American. And I think it's a fair question for them to ask is what are you doing to fix the problem within before you step out to try to fix it? So I think that's something we all need to focus on as well.
Guys, this was fantastic, and believe it or not, it's 1:58. We have 2 minutes away. We have one question that came in, and I think you've answered this several times over, but it was what's being done on the front lines to address the crisis. We've addressed that. Our chiefs have been proactive, and you know I believe and please correct me if I'm wrong, but I believe both of your agencies have been identified, COSAP organization, as one of the 8 mentor agencies across the country in pre-arrest deflection. There's only 8, and Coleraine Township and Plymouth, Mass are represented here on this phone call. So again, in answer to that question, I think you're talking and you're looking at 2 of the leaders when it comes to thinking differently, challenging the status quo, and engaging the population in a way that they need to bring the resources into recovery. And I think that answered that question. And I think just want to make sure everybody understands before we close out, if there's questions that weren't answered, we will get to them and we will provide them through our forum, because this was this went very quickly, and we make sure that you know, we appreciate you. We appreciate the fact that you've joined us today. We appreciate the fact that Chief Botieri, Chief Danny, Chief Allen joined us to have this conversation. And this event it's been recorded, and it'll be on the Frontline Responders Network. So if there's those within your organization, or there's someone else that you want to get the chance to see it, it's available that way. It's also on the Frontline Responders Network YouTube channel. So again, I think that one of the most important pieces, and we are continuing to learn. Didn't want great to get in the way of good. We pushed out in July, you know, we wanted to do August, and we're continuing to work. You know, the development of this initiative is ever changing. Just as the pandemic is different, we want to evolve as we go along. The representation you see in our panels, we understand that we want to bring in more and a diverse group of leaders, diverse group of educators, folks from the front lines, and give you the tools that you need to be successful, to be healthy, and to do your jobs more effectively and more efficiently during this pandemic. Again, thank you all for joining us here today. Chief Botieri, Chief Danny, Chief Allen, I can't say thank you enough. And to everyone behind the scenes, Jesse, Dokon, Nicole, Rick, Jack, everybody, thank you for giving us the opportunity to share with our law enforcement community today and those other leaders across the country and the world. Stay safe, stay healthy, and we wish you the best moving forward, and we hope to see you again.